Hello, my name is Dr. Constance Okeke, and like many of you, I am a MIGS surgeon. Along the way, I myself have encountered some challenges that I needed to overcome. Today, I'd like to share with you some of my favorite tips that have made me feel much more comfortable and confident with my iStent surgery in the OR, and have also helped me gain better outcomes postoperatively. Choosing the right patient can make such a significant impact on getting the favorable outcomes for your patients postoperatively.
A good patient has early to moderate glaucoma with good nerve reserve. On 0 to 3 medications, controlled or not, their open angle pathology should be normal. They should also have realistic expectations. Poor candidate essentially the opposite, with advanced glaucoma, high cupping, and uncontrolled on maximal medical therapy. To get the best view, you must be oriented.
Here I'm sitting on the temporal side where the corneal incision will be made. The patient's head is facing towards the ceiling at this moment. Rotate the head of the patient away from the surgeon, and don't be shy about this rotation because it needs to be significant. Angle the microscope about 45 degrees towards the surgeon. This is needed in order to get an adequate gonioscopic view. Here I am using OVD, a viscoelastic, on the surface of the cornea. This is very helpful in providing coupling with a gonio prism. It allows not only for protection of the cornea, but also allows a light touch to avoid any corneal striae. And here is the microscopic view showing a copious amount of viscoelastic on the corneal surface. Following these steps, you should be able to gain an excellent view of the angle. At this point, it's okay to open up the iStent.
I have found that marking the most prominent episcleral vessels nasally has helped to aim for the best outflow channels. Here I am marking the most prominent vessels I see. The bluish hue of the corneal marker correlating nicely with an area of blood reflex in Schlemm's canal. Here is another patient. You can see the corneal markings indicating very slight blood reflux in a lightly pigmented TM. I aim my stent position here for the best chances of good outflow postoperatively. For me, performing the iStent first before cataract surgery has been the most significant change that has allowed for my success with iStent insertion. This is a clip from my most challenging case before I made the switch to iStent first. I haven't seen a case like this since. First, temporally, a corneal incision is made with a 15-degree blade that has about 1.5 millimeters width of incision. This is a perfect size for the iStent. Then viscoelastic is instilled. I use Viscoat here, which helps to stabilize the chamber. Also allows for economics of not needing to use additional viscoelastic later on in the case. Here, with a stable view and a stable chamber, I'm able to make an incision into the trabecular meshwork. And even though I'm a little bit hesitant in placing the iStent, there's some heme that has come out, but because the chamber is so well stabilized with the viscoelastic and with the small wound, so there's not a lot of egress of the viscoelastic out of it, there's no corneal folds, I'm able to place the iStent on a second attempt easily. Now with the actual iStent insertion, I found being slow, steady, and intentional, and remembering to twist my wrist has been the key. I approached the angle with intent to pierce the TM with my tip at a 30-degree angle. Notice how the iStent inserter swings from the left to the right and then stops in a 90-degree angle. It is here where the heel of the iStent is then seated properly so that it can be advanced forward into Schlemm's canal. A nice egress of heme is seen at the insertion site, indicating excellent placement. Now remember that iStent inserter going from left to right? Well, that's the twist of the wrist. As you can see here, there's a significant movement of the wrist that allows you to get in the proper placement and then advance forward. Again here, the iStent being inserted, the inserter moving from left to right, and then advanced forward seated into the right position in Schlemm's canal. I hope these tips will be helpful to you as they have been for some others that I've coached. For tips on the iStent and other MIGS surgeries, check out my YouTube channel on iGlaucoma.